Thank you for joining us for a virtual presentation on conquering COVID in Philadelphia's Black and Latinx communities, Education to Combat Mistrust Following Vaccination Scandal. We are COVID Care for Communities of Color, a student team in Dr. William Macrino's course, Collaborative Writing Practices, Writing for Social Media, at Rutgers, the State University of New Jersey. Over the course of the semester, we have conducted extensive research to produce multimedia content regarding racial disparity in Philadelphia's COVID vaccine distribution. You can find us and our work on Facebook, Instagram, and our team blog, all of which will be linked at the end of this presentation.
Hi, my name is Lucia Bellino. I'm a business and technical writing minor at Rutgers. I also have extensive experience with education through my positions as a first-year interest group seminar leader for Exploring Chemistry and as a learning assistant for 3 years for Extended General Chemistry. I also have experience with science communication as an intern at the Rutgers Geology Museum.
Hello everybody, my name is Maggie Kelly. My credentials include being a peer health educator at Rutgers, specifically in the field of mental health. I am also a certified health educator at the Central Jersey Health Consortium, and in addition to these, I am also working towards a health disparity certificate at Rutgers University, New Brunswick.
Hi everyone, my name is Fedleen, and I'm a physics major and a double minor in political science and philosophy, politics, and economics. My prior experience includes social media marketing, and my career goal is to make a difference in the world, which I hope to accomplish after becoming a lawyer and studying immigration law.
Hi everyone, my name is Amy Tawfik. My credentials include I'm a technical writing minor. I have experience with social media. I do have all the platforms, Facebook, Twitter, Instagram. I also have a blog on WordPress. And I have interned with websites before, and I was a content writer and editor for them.
Hi, my name is Isabel Seng. I'm a business and technical writing minor who has completed 2.5 years of the 6-year Doctor of Pharmacy program at Rutgers Ernest Marriott School of Pharmacy, and I'm the current president of the Rutgers chapter of the Pediatric Pharmacy Association. I also have over 2 years of experience with digital writing and publishing through my book blog on WordPress and its associated Instagram and Twitter accounts.
I would like to give a warm welcome to the Executive Director of the Philadelphia Health Partnership, Ms. Anne Marie Healy. We aim to increase COVID-19 vaccination of Black and Latinx individuals in Philadelphia. Through our robust review of published scholarly information, we have determined that a two-pronged approach that incorporates an educational initiative specifically tailored to the Black and Latinx communities of Philadelphia, in addition to an effort to improve the accessibility of vaccine registration, will best achieve our goals.
We believe that COVID Care for Communities of Color's goals align with the mission of Philadelphia Health Partnership through our commitment to eliminate health disparities in Philadelphia, specifically in COVID-19 vaccination, by providing Black and Latinx communities with quality services that recognize the structural causes for this medical inequity. Although Philadelphia Health Partnership has funded efforts that translate COVID information for community members, like initiatives by the African Family Health Organization and Hispanos Unidos para Niños Excepcionales, the next step to reduce medical disparities caused by COVID is to increase vaccination in Black and Latinx communities. That is exactly what COVID Care for Communities of Color aims to do.
A little outline of what we're going to be talking about. We will first cover the statement of need of why we chose to start up COVID Care for Communities of Color. Then we will head over to the project activity, which will include the social media initiative and the accessibility initiative. Then we will head over to the timeline, how everything is going to play out. And then there will be an intended outcomes, what we hope and to see with our proposal, followed by the budget, and we will end with an open audience for any questions. As of mid-January 2021, the state of Pennsylvania had the greatest disparity involving race and COVID vaccination rates. Approximately 1.2% of white Pennsylvanians had received the COVID vaccine in comparison to just 0.3% of Black and Latinx Pennsylvanians. Black and Latinx adults are 3 times more likely than white adults to contract the new COVID variant, and only 42% of Black Americans are even willing to receive the vaccine. This is caused by many factors. For one, there is historical trauma caused by a study that was conducted by the Tuskegee Institute. This has caused many Black citizens to have medical mistrust, including Latinx communities. There is also a huge lack of education for all things COVID related. Many Black and Latinx Philadelphia citizens do not have access to COVID resources. Looking at the pie chart, we can see that Philadelphia's population is largely Black and Latinx. Comparing the pie chart that shows who has been vaccinated, we see that Black citizens are one of the smallest groups vaccinated alongside the Latinx communities. The mistrust that Black and Latinx individuals may have already had in COVID vaccination distributions might have also been worsened by the vaccination scandal caused by the city's partnership with Phillies Fighting COVID, or as we know, PFC. Philly Fighting COVID vowed to vaccinate 500,000 to 1.5 million residents during the spring and was supposed to increase the number of minority residents who were vaccinated. But the organization's first clinic was already marred by a questionable behavior. At Philly Fighting COVID's first event, the demographic data from over 2,500 vaccine recipients were lost. The organization claimed that the losses were caused by a glitch in the Amazon cloud, but their remains are no confirmed and if there were actually happened to have the data. Furthermore, the organization's CEO, Andre Dorsheen, admitted to removing a vaccine from a clinic and administering it to his girlfriend himself. The organization also changed its status from a nonprofit to a for-profit without alerting public health officials and after collecting the personal information from nearly 60,000 residents through its vaccine registration website. James Garrow, the communications director of Philadelphia's Public Health Department, released a statement. As part of this change, PFC updated this data policy in a way that could allow the organization to sell data collecting through the PFC's pre-registration site. While the website still named the PFC a nonprofit, although Dorsheen acknowledged that the data policy was concerning and later changed the wording to protect users' information, the city immediately terminated their agreement with PFC after the incident. Despite the dissolution of the relationship with Philly Fighting COVID, the city of Philadelphia still needs to earn Black and Latinx residents' trust for the COVID vaccine. So our first plan of action is to help decrease health disparities regarding the COVID-19 vaccine through using social media as an educational tool for residents of Philadelphia. Our Facebook page is under the name of COVID Care for Communities of Color, and our Instagram page is @COVIDCarePhilly. Everything posted on one page will automatically be posted on the other. As younger social media users are more likely to use Instagram and other older social media users are more likely to use Facebook, these two social media types will ensure a large age of demographic is reached. This is encouraging as many people as possible to learn about and sign up for the COVID-19 vaccine.
So the first type of post included on our two social media pages are vaccine education posts. These posts have a goal of educating the overall Philadelphia population about the COVID-19 vaccination in general. So these posts will include information on how to get vaccinated, including links to vaccine signups, waiting lists, and standby lists in the Philadelphia area, where to get vaccinated, posting about organizations who are administering the vaccine, and advertising vaccination registration vans, which we will expand upon later in this presentation. Why everyone should get vaccinated, including information on herd immunity and COVID-19 death rates. And these posts will also debunk common myths about the COVID-19 vaccine and vaccinations in general, such as it being unsafe or not necessary for certain people or populations. The image that you see on this slide is an example of one of our vaccine registration posts on our social media pages. The second type of posts featured on our social media pages are the historical connection posts. Historical connection posts will serve to educate Philadelphia locals and anyone who follows the social media accounts on historical trauma, medical mistrust, and racism in general. Historical connection posts will 1. Educate followers on instances and examples of historical trauma. 2. Explain why communities of color are more likely to have mistrust in the COVID-19 vaccine. 3. Aim to combat overall institutional and structural racism. For those who do not know, institutional and structural racism is racism that is embedded in society. These posts will also help to build understanding and support between racial and ethnic communities in Philadelphia, which will help the Philadelphia community to grow closer even after the pandemic comes to an end. So the image that you see on this slide is an example of a historical connection post on our social media pages, focusing on the Tuskegee syphilis study, which was an unethical study that has increased historical trauma and medical mistrust in the Black community. Through education, we hope these posts will help decrease instances of racism during and after the COVID-19 pandemic and prevent repeats of historical trauma and medical abuse in communities of color. Our third type of post are representation posts. Our team is working to eliminate health disparities regarding the COVID-19 vaccination in Philadelphia, specifically within the Black and Latinx communities. As Black and Latinx communities have a history of historical trauma and medical mistrust, they are less likely to sign up to receive the COVID-19 vaccination. Representation posts will help to encourage individuals in these communities to sign up for the vaccine through showing evidence of other members of these communities receiving and/or advocating for the vaccine. Representation posts will A. Show pictures of individuals in Philadelphia's Black and Latinx communities who are 1. Getting the vaccine, 2. Have received the vaccine, or 3 are healthcare workers, and B will have a caption of a quote said during the interview of the individual on 1. Why they are receiving the COVID-19 vaccine, 2. The benefits of receiving the COVID-19 vaccine, 3. Personal stories regarding the COVID-19 vaccine, and 4. Why it is important for Black and Latinx individuals to receive the COVID-19 vaccine. COVID Care for Communities of Color believes that representation posts are necessary to help encourage individuals in Black and Latinx communities who are hesitant to receive the vaccine to sign up to receive one after seeing positive experiences of other individuals in that community regarding the vaccine. The image that you see on this slide is an example of a representation post. Now we will move on to the second part of our activity, vaccine registration vans.
Technological disparities also play a significant role in healthcare inequalities, which we seek to address. According to a study by the Massachusetts Institute of Technology and Carnegie Mellon University, quote, children who are low income, lacking proper housing, African American, English learners, or of Hispanic ethnicity still lag behind their peers in terms of internet access, end quote. The 2018 census showed that 16% of Philadelphia residents, or over 98,000 households, did not have an internet connection. This lack of access to the internet results in a lack of access to healthcare, including COVID tests and vaccines. Added to health disparities, historical trauma, and medical mistrust, this exacerbates the racial gap in COVID vaccine access. Thus, our accessibility initiative. We plan to deploy 3 vans throughout the city of Philadelphia, each equipped with 2 iPads, which will provide a portable internet connection, as well as a multilingual translator and an educational assistant to help Black and Latinx residents navigate the process of signing up for a COVID vaccine. For everyone's health and safety, our staff will be provided with face masks, and the vans and iPads will be sanitized frequently. The location of each van will be regularly updated on our social media pages so that Philadelphians can easily find us. We do not anticipate that lack of internet will be a significant obstacle in this regard, because individuals often gain access to online communities, such as social media accounts, through classmates, colleagues, and other acquaintances, without the stigma that may come with borrowing the use of Wi-Fi for something like vaccine registration. Initial timeline spans 6 months, with the option to extend and potentially expand the project further. During the first month, the preparatory phase, we will order our supplies and hire and onboard our staff, journalists, a social media manager, a volunteer coordinator, and van drivers. At this time, the journalists will begin preliminary research about COVID vaccine data and registration information, which the social media manager will use to begin establishing a social media presence for our 2 initiatives. The second main phase of our project will span months 2 through 6. The vans will be deployed throughout Philadelphia. The volunteer coordinator will recruit, organize, and train university volunteers to serve as multilingual translators and educational assistants. The journalists will keep up with vaccination updates as well as interview and photograph consenting Black and Latinx healthcare workers and vaccine recipients. The social media manager will publicize these updates and interviews in frequent social media posts as they continue to cultivate our social media presence. At the end of 6 months, we will enter the third phase of our initial project. This is when we will evaluate whether to modify and continue either or both initiatives, based on whether we have achieved our desired outcomes.
Our goals are to increase the availability of accurate information about the COVID-19 vaccines and to increase registration for the vaccine.
To increase accessibility, we share information via social media, engage with followers to gauge the impact of this information, and through surveys after registration to gauge knowledge of the vaccine from the communities that we hope to serve. To assess the registration element, we will examine the number of participants we register after the implementation of our project and examine the demographics of the registrants to ensure we are serving the communities we hope to help. After the 6-month period, we will review the data that we have collected. We aim to have the vaccine recipient demographics match the demographics of Philadelphia's population. For example, 44% of Philadelphia's population is Black, so 44% of vaccine recipients in Philadelphia should be Black. We hope that 95% of our participants are self-reporting as either moderately informed or very well informed about the COVID-19 vaccine based on the data from our social media polls and post-registration surveys.
In order to materialize our education and accessibility initiatives, we are requesting $201,560. Nearly half of this budget, approximately $99,000, will pay for the salaries of employees hired by COVID Care for Communities of Color. The journalists and social media manager that we plan to hire are critical to the success of our educational initiative. Likewise, a volunteer coordinator and van drivers are imperative to fulfill our accessibility initiative and provide the residents of Philadelphia with resources to register for the COVID-19 vaccine. To minimize costs, we are planning to purchase 3 used vans to distribute through the city for vaccine registration. The cost for the 3 vans, decals with our COVID Care for Communities of Color logo, and gas throughout the 6-month period is approximately $95,000. We are also asking for just under $3,000 to pay for advertisements on Instagram and Facebook for our social media pages, in addition to flyers to recruit student volunteers to assist with registration. Each van will be equipped with 2 iPads with cellular data to allow for vaccine registration, which accounts for another $2,500 of our budget. Another $3,700 will be utilized to purchase laptops and a camera for our journalists to produce information for our social media sites. Finally, the remaining $200 will be used to purchase safety equipment like KN95 face masks as well as buttons to identify our student volunteers. To review, we first addressed our statement of need and presented the racial disparities present in COVID-19 vaccination distribution in Philadelphia. We then went over our plan to combat these issues, including both our social media and accessibility initiatives. We walked you through our 6-month timeline for the project, as well as our expected outcomes. Finally, we presented the budget required to execute our initiatives. Thank you so much for your attention. We welcome you to follow us on social media and to contact us with any questions you may have.